Commission report is all about better healthcare for Australians into the future. We went out through our extensive membership and networks, including across social media, asking consumers to put in an expression of interest in being part of the Commission. We were oversubscribed, and we also asked those prospective commissioners to give us some ideas about the sorts of things, the sorts of big issues that they wanted a Consumer Commission to look at. So we had an independent panel select those 30 from over 70 or more applications. The other thing we did was we wanted to benefit from what we knew from experts, particularly the research community, about what we already know from evidence and literature. So we supplemented the insights of consumers with interviews with national experts.
I'm Tony Lawson, and I'm chair of the Consumers Health Forum of Australia. And I also chaired the Consumer Commission that CHF established earlier this year to identify the lessons for consumers from COVID-19. A number of things came out of that process for me, but there are three key things that I wanted to mention. Firstly, was that we had a group of really experienced and wise and committed consumers who contributed to the process. Secondly, the process that we used was demonstrated a really good way to engage and involve our consumer commissioners. And thirdly, I believe that the outcomes of the Commission will result in greater respect for consumer input into major health issues in our country. It now gives me great pleasure to hand over to 4 of our 30 commissioners for their brief insights.
I really enjoyed the discussion around health equity as part of the Consumer Commission. There was a lot of discussion around health promotion, prevention, and action on the social determinants of health to address the health inequities that we see across Australia in terms of vulnerable and marginalised communities. We heard about recommendations for social prescribing, which is really important. We've heard about needing at least a 5% of total budget spend in that health promotion and prevention space as we move towards 2030. So I'm really looking forward to the opportunities that linking that to the National Preventative Health Strategy can bring coming out of the back end of this important Consumer Commission work.
Consumer leadership and authentic partnership are essential. It needs to be embedded into all elements of the health system via leadership, via co-creation opportunities, and via formal governance structures. The establishment of an independently governed National Health Consumer Leadership Academy will not only create an opportunity for patients and health consumers to share the great depth of knowledge that they bring in terms of their lived experience, but it would also give greater confidence, skill development, and peer support opportunities to all of the health consumers and patients who want to participate in improving health, in enhancing patient experience, and ensuring that in working together, we achieve so much through our partnerships.
I think digital technologies was the most interesting conversation from my point of view, and the way that they're offering users of the health system safe and timely access to appropriate care with literally the touch of a button. The recent COVID-19 pandemic allowed millions of Australians the opportunity to become accustomed to the resource, and their overall response was pretty positive. So there was an overall feeling that the health system needs to support continuing advancements in digital technologies and ongoing training, not only for the patients in how to use this resource, but for the health practitioners alike who need to understand the differences between face-to-face consultations and these online opportunities. We need to ensure that it's available for those who need it the most, where they need it, but particularly when they need it.
We have a genuine opportunity to step change the way we deliver healthcare and achieve something we all want. Illness is hard enough. As people move through their personal illness experiences, both patients and clinicians want healthcare services to be available, coordinated, easy to receive, and seamless. Everyone wants healthcare that comes together when patients need it and regardless of where the services are coming from. And it starts with the way we invest in health. One of the most significant recommendations from the Consumer Commission for me was about the funding, wherever it's coming from, to come together and lead the change. Rather than follow the money, we have the chance to use the money differently, to follow the patient and drive the change patients need. And that's exciting.
Some of the key recommendations include the establishment of a National Consumer Leadership Academy. Not surprisingly, consumers really can have impact if they're equipped with leadership skills in order to act with impact and influence. So that was a top line recommendation. We wanted to see continuation and further development of telehealth and virtual care, integrating that in as an enhancer to existing relation-based face-to-face healthcare. We wanted to see a 5% at least investment in preventative health. We wanted to see a national health literacy campaign, because we know that if people are equipped with the confidence and the information they need to better manage their own care and self-care, we get better outcomes as well as a better experience of care. We wanted to see and recommended for a national social prescribing scheme, because COVID highlighted to all of us the very real impact of the social determinants on healthcare outcomes. And another recommendation that came through very strongly is the idea of a national system of digital navigators to help both consumers and clinicians get much more equipped and confidence to use digital health solutions. And then finally, because we hear repeatedly, and we heard it reinforced through the Commission, disconnected, fragmented healthcare is the pretty common experience here in Australia. So a national network of care coordinators is something that the Commission also wanted to see, particularly to help out those people with low health literacy, but also with an incredible number of multi-morbid conditions, many chronic conditions, often coexisting with mental health issues. Consumer insights are a powerful way to achieve change. They come with no vested interest, just lived experience and better ideas for how we can improve healthcare. There's no doubt that COVID has been a big disruptor for health. It's stimulated a lot of change. Some of that change we want to retain. Some of that change exposed fault lines that we are really concerned about. And some of those changes prompted us to rethink how we can improve healthcare. So that's what we put to our Consumer Commission. What are some of the structural, practical changes that we want to see come out of the COVID experience that endure in health policy and health services for the future?